Hi, I'm Bogdan.
I'm Carl.
But today we're going to be portraying Jordan. Jordan's a local government employee, but he's also an active member of his community. In the past, Jordan would spend significant amount of time and resources gathering the information he needed to measure the pulse of his community. From countless disparate data sets, coupled with lack of funding from his department, basically meant that Jordan's progress was pretty slow and mainly fueled by his own desire for impacting or creating social change. Until now, Community Beat is a dashboard that allows users to get a pulse of their local community and includes information from 7 trusted data sources, including the CHHS Open Data Portal, ACS, the California Office of Health Hazard Assessment, and ASCHIS Neighborhood Edition, or the California Health Interview Survey. Using Community Beat, Jordan figured out that his community, which is located at 90001, has a lot of work to do to increase the health status of its inhabitants, and also to make Huntington Park, which is where this zip code is located in, a better place to live. His zip code is in the bottom 20% of zip codes in terms of a healthy beginnings ranking, which Carl will talk about, has high environmental health and equality, and also has a pretty low local economy ranking. Compare that to a neighboring zip code, which is 90035. That zip code is about 15 minutes away from Huntington Park. If you look at the screen, you'll notice that 90035 is in the top 20% of all zip codes in California with regards to the Healthy Beginnings Index, has fairly low population pollution burden, and is pretty high in the local economy index. But Jordan also realizes that it's not all bad news. If he goes back to the data, he'll see that his community is relatively young, has a median age of 26 years old, has below average unemployment, although still high, and it has fairly good paying jobs compared to the average household or mean household income. The average payroll per employee from the IRS is $42,000.
So what we provide is 4 composite scores for users to quickly get a pulse of how their community is doing. And so the first index we have is a Healthy Beginnings ranking. This uses vital statistics regarding beginning of life, including prenatal care and birth weight, to give you a sense of how your community compares to other communities in California. Next, we have a pollution burden score, which comes from the Office of Health Hazard Assessment. It's a Cal-Enviro score. It's used to evaluate how communities are affected by pollution. The next we have is a local economy ranking. This uses indicators like median income, poverty, unemployment rate, to give you a sense of how your community's economy compares to other communities in California. And lastly, we have a housing index, which comes from Zillow. They use indicators like median house price, how long houses are on sale for, and mortgage information to give you a sense of how your community's housing market compares to other communities. On top of that, we also offer over 40 individual indicators with charts and graphs to give users an easy way to evaluate how their community is doing.
The hours of data management and big money to data consultants just went to nothing in 5 minutes using Shine.
Any questions?
Should we just start whenever? Yeah. Cool. All right, everybody, we're the creators of Health Bits. Next slide. 24 hours. So the problem that we see in health information, in the health space, is that there's just too much information. And you can find stuff from ZocDoc, their hospital, Blue Shield, Yelp, it's everywhere. And that's not even considering the open data that's available today. And there's another problem. Actually, sometimes you can't find the information that you need. For example, do they take Medi-Cal? Do they have specialty services for asthma, for example? Or do they have are there local community clinics that can satisfy some of the health needs that I have? And I think understanding this information, even finding it initially, is a daunting task. And that's no wonder why a lot of people end up defaulting to the ER or urgent care. And now that we have an influx of new patients coming from the Medicaid expansion, I think it's even more critical that these patients have an opportunity to identify the healthcare that they need in a way that's understandable without having a huge background knowledge in the health space. And so that's why we created Health Bits. It's a simple and personalized way to get smart on healthcare and find the help that you need. And so we'll go into the demonstration.
Cool. So
what you see right here, I'll give you a bit of description before I jump in. So users input their information, like their medical condition, and then we use this information and combine it with an array of open data to create a personalized rating score for each hospital that they could potentially visit. And the key here is that we're using information that the patient has provided as well as supplemental information from open data portals to create an easily to understand metric that also provides transparency in terms of the underlying metrics that we use. So in this example, this is Los Angeles, and we're looking at Ronald Reagan UCLA Medical Center. And if you see to the right of it, here is the rating, a B rating that we created, which for us is normal. A is great, and so these are the stars on the map if you see it. And red means that there's stuff to improve on, specific to that particular case. So this one on the map here, you see this is for average of all different types of cases across hospitals. But let's go and dig into a specific case. So let's say we go into acute stroke. Now here the map changes, right? Now there are more on the B rating side and not so many on the A's, and you can dig in and see. So if we look at a specific example here, let's look at Glendale Memorial Hospital and Health Center. What you have is not only the rating, you have the underlying metrics that we're using, and then you also have, for example, more contextual information, right? Some of the information that we're using on here includes mortality rates, inpatient infections, Medicare ratings from Center Medicare and Medicaid, other condition-specific metrics as well that provide you information, for example, here that they have a higher, above-average risk for acute infection outbreaks. And the important thing to notice here is that we also have options targeted to the underserved, right? Which is, can I sort by Medi-Cal, right? And can I sort to find other type of community clinics that will help? And so I'll stop right there. And one more point that I want to bring up about the score that we've developed is that this is really only using open data now. But imagine if we can supplement it with more information. Then you can create a more granular score, provide more transparency, but specifically, you can help a lot of underserved folks, for example, find community clinics, federally qualified health centers, for example, is another thing that we want to add here, as well as other data available, unstructured information that you can potentially find to supplement some of these scores. And so, thanks everybody. We believe the future of healthcare is personalized and with better information for patients across the nation. Thanks so much. Get smart, where health is.
So we're Team Engaged Patient. Talia has a computer science background, and I'm an engaged patient and a lawyer, and we're both volunteers at Code for San Francisco. So the landscape in healthcare is changing. Patients are becoming activists, and they're making a difference and want to help out and make policy changes in healthcare. So what do they need? They need data, but data isn't always relatable to individuals. And even when it's visualized, it doesn't really help them. So they need some help with data to change policy, to impact policy. So in order to use data to change policy, you need to be able to tell a story. It needs to have that ability to tell a story. So what we did was we created an engaged patients platform. And that allows patients to create stories using visualized data that came from the lens, from the open data portal. Using the lens, they can create a visualization, they can share that visualization, they can talk about it with their peers, and they can collaborate together. So on each side you can see that we have the two people, me and Talia, and we have two pieces of data that we created a visualization for, and so we can live talk to each other about the visualization and how we can change it, what would be an interesting story in order to help our particular patient groups. So whether we're talking about asthma or cancer, or we're talking about women who smoke. So the two data sets that we used, we took a look at and created our visualizations using the portal was the data set for asthma in all throughout California to 2012 in all areas by zip code, and then we looked at female smoking for certain years in California for all counties.
will tell what's happening here.
So we have this live where it's up a web app up on Heroku. Right now, Tanya is interacting so that we're talking to each other.
Yeah, we have a bit of a problem with the network here, but as you can see, as I'm typing on this is a presentation computer here, so as I'm sitting on a totally different side of the nation, and I'm writing things in, I can click on the edit button, and I can make changes. For some reason the network seems to be slow now to slow it down, but you can see here that as I wrote that, there was a change down here, and there's actually a change over here on this computer too. So the important part here is this is real, allow real-time collaboration about creating a narrative around this data. And this is an extension of the open data portal.
Any questions?